you've been on my podcast before. She's got issues. This is obviously a emergency episode, and I hope to do these with a bunch of experts. Max is also a comedian you've met online. We're not gonna we'll probably be a little easy on the jokes, but you gotta spoon feed people spinach and chocolate. So so
that's the combination you figured out for healthy and fun.
Spoonful of sugar.
Yeah, exactly, with some kale. So I guess to start, maybe just introduce yourself, your background in public health, and I thought you would give an outline on what public health is, because I guess if public health's working, people don't really think about it.
That's a great point. So my name is Annie Feighery. I have a doctorate in public health. I say this for the layperson, public health, but within public health, there are a lot of subdomains, epidemiology being one of them that we appreciate most right now. Mine is health education and health promotion. And it goes back to the oldest roots of the CDC is health promotion. The actual name of the CDC is the Center for Disease Control and Prevention. And its funding and its directive, actually under President Nixon, was to create an institution that would help prevent terrible, serious illnesses in the US. And so that's out of the roots that I come from. People in public health help direct the parts of the medical system that you see most visibly. We help to, some people research what's called the Cochrane Review that writes the standing orders for what doctors do and are allowed to do. My version of public health is to try to communicate health directives and initiate programs that keep people from getting sick.
So you must be pretty busy these days.
Well, so I work internationally. I run an international NGO, an international nonprofit organization. And we work mostly in the field of water and maternal and child survival. But we also work in emergencies, and water covers COVID, unfortunately, that just like Ebola at its essence was a wash disease. WASH stands for water, sanitation, and hygiene. COVID is a wash disease. If people have access to safe water, they can, abundant water especially, they can wash their hands and not just have enough to drink or cook with. But also it does look like there's a fecal transmission route that is possible with COVID. So as this moves into more low-income countries, we're trying to prepare as an international community for a big hit there.
A big hit in Africa or all over
in places, not just African countries, but in places that are low resource. It could be South American countries. Most South American countries have done great in recent years in water infrastructure, but sanitation infrastructure often lags behind. And so when you look at safe fecal containment, there's a whole field called fecal sludge management that is going to be very dangerous right now.
Okay, so before I ask you about that, fun times. I'm already more terrified than I was 5 minutes ago. But I remember
can you imagine the person who wakes up excited, goes, I can't believe I'm in fecal sludge management. I'm living the dream.
There are those people. There are dedicated scientists who do a great job focusing on FSM.
Thank goodness for them.
Yes. Way to make it sound like a really exciting night out in an S&M club. FSM, wow.
Yeah, it sounds like a fun state college to go to. Oh my God, I got into FSM. It's gonna be amazing.
So want to get into FSM? No.
So what about, I remember last time you were on my podcast, you said South America is way ahead of us in water because they actually talk about it. Right. They acknowledge they have a water problem. Isn't that half the battle first? You have to acknowledge.
I think that's part of it. There's a lot of people don't think about their dependence on the water and sanitation infrastructure. And we're so lucky here. For example, this comes really present in COVID because if a person gets infected with the disease, after they're infected, their feces could potentially be a source of contagion for 5 weeks if they didn't have a safe sewage system. We're
5 weeks?
5 weeks.
Why? Because
it's so lucky that we have a very, very well-built, most Americans, there are Americans that don't have access to safe sanitation. but most Americans have access to flush-based sanitation where it goes away and you don't have to think about it. But if you're sick, for any of us in America, you worry about 10 to 14 days after you're finished being sick. You're still contagious, ongoing, lingeringly through your mucosa mostly. But afterward, your feces might have it for 5 weeks.
So can you explain why, if it can only live on a surface for maximum 72 hours, your feces can hold it for 5 weeks?
That's a great question. There's lots in the dry air. There's lots of interference on a surface that, and not for accident, these viruses evolved to live at human body temperature. You know, this made the great jump, zoonotic jump, because this virus was good at human body conditions. And so something like, can it survive your digestive tract, is an evolutionary advance for this virus.
For this particular virus?
Yes.
This is an advance.
Yeah, not all viruses can.
Oh, so these viruses are really, really, like, they're just advancing because they just want to kill us. That's all they want to do. It's like Thanos' army.
It's so tricky for viruses. They want to survive long enough to be spread a lot, but they don't want to kill us right away. So one difference between this and SARS,
human beings on the earth.
So SARS killed people too fast for the virus's own good, right? SARS was too deadly, and SARS was easier to contain as a result of it being a little bit less deadly. This is, we see that this survives very well in young people. They can go out and be super infectious. They can go to St. Patrick's Day parties, for example, and give it to lots of people because they don't even know they're sick. The virus, we call these young people vectors then. The people that are, a creature or a person, some system that is very good at spreading the virus is a vector. In this case, the young healthy people are vectors. And we have to be careful for that this virus likes to be spread. And up to 84% of transmissions right now are from people that are asymptomatic or pre-symptomatic. And so this virus is being spread by people who think they're fine.
84%?
And people who get really sick stay home and they don't spread it, right? So the people that are younger and don't feel like they're sick, they don't stay home and they spread it.
Does are animals vectors yet? Am I correct in calling my dog a furry little disease vector?
Yes, my dog is a vector. I have 2 teens in quarantine in my home right now. They're home from college and school, and we don't let the dog in their rooms because if they pet the dog and then I pet the dog is a vector.
So you're really putting the teen in quarantine.
I call them my quarantines.
Are they quarantined from each other?
Yes. One is in like one room and the other's in another room, and they have separate bathrooms from the rest of the family too. We're lucky to be in the West for this virus. I lived in New York up until this year. That never would have been possible, but out West, houses have lots of rooms and several bathrooms.
Okay, so a few things. I'm going to come back to this because how to quarantine is really important. And I know you mentioned sealing up, which is very hard for a lot of us to do. But I want to go back to one thing. Even up to 6 weeks ago, you were saying facts about how to spread this virus and how if I was sitting within 6 feet of someone, like in a jacuzzi, no, I'm not going to get it through the water. I'm going to get it through the air. You were saying that way before the media was saying that. I mean, you really had to dig through stories to actually find the truth. So one more time, for the cheap seats in the back, how does this virus spread? All the ways, at what distance, everything.
Okay, the number one way that this virus spreads is by touching a person that has it. And this can't be underestimated. Yes.
I'm not touching you. I'm not touching you.
So think about the Utah Jazz players that had it. The day before they were tested and they knew they had it, they were at a game and did some autographs. 2 players of the team that were later found to be positive. A little boy that got an autograph caught it from them. So touching people and sharing a surface with them is the number one way that this is spread. And it's really contagious. It's that contagious that a little boy who got an autograph probably just shared the pen and the paper that they signed. He got it, right? So there's other ways that it's contagious. It does float around in the air for a bit as it comes out of someone's mouth as they're talking or coughing. In dry areas, it can hover in the air a little bit longer. And this is because in humid areas, that virus might bond to a bit of water and fall to the floor. Then you say the floor is a vector. You see very fast in my family, like we quickly made a game where we just were like saying, this is the vector, you know, but
Sounds like a really fun game. That's something
everything becomes the vector, you know. Somebody talks about a great new idea they have and you're like, that's the vector, you know, like sharing a book for school, you know, becomes the vector. But sharing surfaces, the floors have to be kept clean because the viruses fall to the floors. The surfaces can be cleaned pretty easily, but they have to be cleaned often, and they have to be disinfected. The issue with the spread of this is it is a very contagious disease, and the single best way to protect yourself is to stay inside your home. You can't be around other people. And this is twofold. If you have it, you won't know for a while. You won't know for 5 to 14 days. And you could be out being the vector. And if you don't have it, you know you're safe if you stay in your home and you don't let anyone or any surfaces that could be vectors in your home.
On a chart, MERS, SARS, swine flu, bird flu. What else have we had? Well, we had Legionnaire's disease here, but that was I think that's water-based, like it's in the water. Anyway, those four, MERS, SARS, bird flu, swine flu. Where does this fall as how contagious it is?
This is somewhere between swine flu and the normal and what we would call normal flu. This is I don't want to conflate this with normal flu in any way. This is much worse. It's not as bad as certainly MERS. That's one of the most contagious and scary ones that we've dealt with. In public health, you would call this question, what is the R naught? And that looks literally like an R and a 0. And that's how many people can a person infect. On average, the R naught for this is somewhere between 2.5 and 3. When China shut down all travel options and literally in some cases welded people into their homes, like really draconian measures, the R naught dropped to 1. So imagine how many people does one infected person have a chance to infect? Is really a matter of policy. Now in Korea, there was a woman who had a super spreading event. She had a car accident. It's not clear if she was contagious before the car accident or if she went to the hospital because her car accident and she became contagious then. And then she went to church, and she went to a church with 4,000 people. And then she infected 1,200 people in that church.
What?
And then she went to a buffet restaurant. And she infected another 400. And then she started feeling sick. And then she went to the hospital, right? So there are R naughts that go off the chart. You're worried very much about a super spreading event. That's why you saw sporting events close down first. Because super spreading events are the biggest fear, that one person could end up in a stadium with 70,000 people, right? So
even on smaller scale too, right? In New York, one of the first big cases was someone in Westchester went to, I think, a bat mitzvah with 700 people.
So these super spreading events.
That's a super spreading event?
That's a super spreading event. And that's the first thing they did was to say, oh, no more than 500 people at any event. And then you saw that progress, no more than 50 people at an event. And then you saw it progress, no more than 10 people at any event. And this is going to continue. We're going to see every measure that you see introduced will go through a phase of tightening. And Italy has prepared us for this. They've told us that be ready for what this looks like. And it's increased stages of your public officials taking bigger measures, but in stages so as to not cause panic, so as to not cause like dramatic rebellion from the laws and policies. They're going in stages to try to help people feel safe.
There's a slight adjustment period. We have a day or two to adapt to the new circumstances before something else happens.
So that's the definition of an exponential growth curve, right? Things aren't just bad +1 given the next day. They're bad ×2 the next day, right? It's going to keep getting worse.
When you say like she infected 400 people or something, that is like, that would be like a chart just lighting up because she infected 2, who infected 4, who infected 10, like that, right?
No, I wish I was. That was she infected 400, who then went and in turn infected 400 or 800 more.
She infected herself, 400 people?
Yes.
Oh my God.
There's a great WAPO article that has a beautiful graph of this.
She herself walked around and just by touching what she touched.
So at the church, it was an estimated 1,200 out of the 4,000 people who attended, who then became infected just from one church service.
How would you say these containment strategies are working, generally, but then also if you compare it to what we did for, say, swine flu and MERS?
Both of those events were contained, and we've lost containment, so they're not comparable at all. We very sadly lost containment. We H1N1 went to 27 countries, right? And that was trickling into the last few. It was really contained after about 20 countries. Imagine had we been able to contain this by now, that would be a beautiful story. Several things are very different about this. H1N1 was far more deadly, so it was easy to spot earlier. And then this went wild in very different governance practices. So you can use the governments that it went wild in almost as case studies for how different containment strategies work or don't work. So right now we can see that Iran has told us almost nothing. They have banned their press from talking about it. And it does seem to be, by estimates, by outside researchers, the worst outbreak on the planet, but we don't know. It does seem to be an estimated, I would say of this outbreak, an estimated 6 million people right now have it. And we don't have anywhere that we have to run this on models. We have to reverse engineer it based on the reported death rate. We know that there have been satellite images from space that have visualized digging mass graves in Iran. So we don't know anything about Iran. We know that policy of not saying anything, not telling anyone anything, does seem to result in the worst outcome. China did a great job, as it turns out. We certainly wouldn't pick some of the draconian measures being welded in your apartment that China was able to do, but they contained it. They're producing 1 new case per day at this point. They did bend the curve. It was beautiful. Of the medium grounds without draconian measures, Korea is doing a good job. Singapore, Taiwan, but Singapore and Taiwan especially are city-states. They're small. They're limited in number. Imagine if New York were an island. It would be a city-state into itself, right? But New York, Manhattan's an island, but imagine all of New York were an island country. That's kind of what we're looking at there.
Can you explain a little bit more about Italy? Because that's been really big on the headline news, and I can't tell if they're doing a good job or a bad job, if they're ahead of the curve or behind the curve of flattening the curve.
Italy's probably the closest to what we can compare how the US is going. Italy did not have mass surveillance at any level, and they didn't have a test everyone approach. They tested people when they showed up in the ICU. They're like, oh, why are you an out of control pneumonia case that's getting worse with regular treatment? And then they tested them. And that's really how it emerged for Italy. It wasn't proactive, it was reactive. And so the US is taking that testing approach as well. You see the US government saying, we want to save tests for symptomatic patients. That is a reactive approach. In the case of Italy, they're still escalating. They have not slowed down at all. It's still frightening, and the US is about 10 days behind them in every epidemiological curve you can look at. Where they are today, we will be in 10 days. Go ahead.
No, that's just a big, oh boy.
It is, and one of the worst things that you can look at for measures there's 2 ways that you can watch this. One is how fast you come to exceeding your medical capacity to treat people. How many beds are there in hospitals that are available? How many of those have ICU capacity? How many of those have ventilators possible? And then there's even further measures that people need for treatment, such as ECMO, which is very advanced, to save even the most critical patients. In Italy, they have exceeded the medical capacity. We already, on any given Tuesday, have 70% of our beds filled in any hospital. So you're looking at a country with 30% open hospital beds. We have 15 military bases around the country that have the setup to become outflow, to step up in a pandemic, to provide extra beds. So there is some of that. That's not enough. Like China built 2 hospitals in 10 days. We need to be at that level. We need to be building extra capacity of beds, and we need more ventilators. You know, there's an important measure that was taken today to change the power of the government to have like warlike powers to change factories from producing what they like to produce in peacetime to something the government needs them to produce now. And we need them to produce ventilators and masks, PPE, personal protective equipment.
And so that just passed today, Wednesday, the 18th. So the government's gonna start getting these extra produced ventilators.
They haven't said what they will do with these powers of this act, but that would be my choice. Is, you know, we need ventilators now. You see already in the U.S. some great businesses, certainly people that make liquor, can make alcohol for like hand sanitizer, and you're seeing a lot of distilleries change over to make that. So that's just a voluntary change. In the UK, you're seeing the government direct businesses to begin making ventilators. And you're seeing early steps of that in Germany as well. The US, I would say we need ventilators now.
It sounds like a great platform to announce your candidacy for President of the United States.
How
Annie 2020, Annie 2020, Annie 2020.
What if we had a public health scientist in charge right now, right?
I know. So you have been asking how they can determine where the thing spreads.
Yeah, I'm curious from a forensic standpoint, is there a way to track back who the first person was with this, who the first person in the US was with this?
And how they do it, like that super spreader church. How do they know those people didn't have it before?
But absolutely, they're in the beginning was that capacity, but that's actually the definition of we lost containment. In containment, you can track who gave it to who, and then you go back and find all the contacts of that person and you make them all isolate. And containment is the best strategy. When you lose containment, it means you lose that trail. That when you have a case, you try to track back who did you get it from, and you can't find anything. And that's called community spread. We lost containment very early because we didn't have a testing capacity as a country.
Do we have that now? Are we going to get tests?
I don't know. I want to be very positive and say that this week is the week, but this is 3 weeks running where we have been promised by the government that this is the week that tests come online in a massive capacity. It does look better than ever that this week is going to be the week. I would say that several great testing companies passed FDA approval and they will begin running thousands a day. But, you know, I'm talking to you from El Paso, Texas, one of the bigger middle-sized cities in the country, bigger than Pittsburgh, bigger than Oklahoma City. And this city has done 33 tests so far.
How do we call ourselves a superpower and we can't do this?
Sorry, go ahead.
This testing debacle is the mistake of our lifetimes. Honestly, there have been 2 very large mistakes that have emerged already in a game you didn't want to make mistakes in. One was we just didn't ramp up testing. And the second was nobody ramped up PPE, personal protective equipment. They've just done some analysis where they found the PPE that arrived in Seattle and in New York in the first 2 big waves were largely expired.
Wait, oh my God.
So imagine this. Imagine had there been an Ebola style czar like there was under Obama, appointed very early in this. I saw the evidence for this emerging in December, and I'm sure more smarter experts than me saw it even a little bit earlier. There should have been someone at that point that just sent out a memo to every public health office in the country, and they are by county, there should be one at least, to say, hey, let's do an asset inventory of our PPE. That would have been the December step.
So then two follow-up questions for you. These scientists that you allege are smarter than you, will they be in your cabinet?
That's great. That's awesome. I don't know. I would say that I have already said a lot of bad things about
you'll still have, you can Skype into cabinet meetings. So now when you say where a community spread, containment is busted, is it a crazy assumption to just assume everyone is infected? Is this why everyone is saying stay inside, stay home?
It's not crazy at all. It's not crazy at all. In fact, it's a big paradigm burst for Americans to have gone through the stage where you were so worried about getting it that now many governments, including the governor of New York, is saying, please behave as if you have it. Because you take very different steps if you're worried you have it. You do try to not give it to other people, we hope, right? So the steps that we took before, where people were very fearful of one another, now we need you to act like you might have it already. That means begin preparedness for yourself. What does it mean? Don't be around your, especially elderly relatives, but around anyone. Do practice social distancing. Stay in place. If you stay inside your apartment for 14 days, you don't have it. If you're able to stay inside your apartment, and that is a wonderful breath of relief that you get to take. The best reason I can say, aside from your sense of civic duty to stay inside your apartment, is it will keep you safe. You stay inside your apartment right now for 14 days, you can stop that fear that you have it. And then you can just live in your apartment for the next 8 weeks, not going anywhere. And if you do receive packages or deliveries, decontaminate them safely, then you're okay. And that sense of relief is wonderful.
So, so for people like us, we live in a high rise with elevators. And we have a dog that we have to walk.
How do you feel about stairs?
Really, 25 flights? So
in elevators, especially, you have to think about this issue that it does live in the air, right? So if someone were in the elevator before you, I'd say hover in the air. I don't want to be scientifically inaccurate. It can hover in the air, right? If someone were in the elevator before you that had it, they coughed a lot, they touched the buttons, So what is your practice? You need a protocol for elevator protocol. Maybe open and shut the door twice, to really make the elevator sort of ventilate itself. Have a practice for what you're doing. We certainly don't have a lot of gloves right now, but I have found that even like tortilla bags or grocery vegetable sacks are wonderful wannabe gloves when it comes to something like touching your elevator button. Touch it with a safe surface. Don't interchange. Begin thinking like the virus. It likes to be on surfaces. It likes to be shared by humans. Think a lot about, if I'm the virus, how do I want to be shared, and really be a detective for how to create a daily schedule. When I take my dog out, take the dog out as seldom as you possibly can. Have an elevator protocol that you never break. Touch the button with something like, your vegetable bag over your hand. When you go out, you have to touch the door. You still got your vegetable bag over your hand. Use that. This is called a barrier method. When you get back in your home, pretend you have it. Pretend it's on your body somewhere. And wash your hands like crazy for 30 seconds.
You brought up an interesting point, so we only go out to walk the dog. And that's when we also walk and get exercise and get to.
And that's so important right now because the second wave impact of this is psychological. So at least you're getting sunlight.
Yeah.
You're breathing. You're looking at nature. Spring is wonderful.
Yeah. And also it lives in our body, which is 98 plus degrees. Why do people think it dies in warm weather?
Oof, we have no idea if it does or not.
Yeah. Why are people saying that? They need to stop saying that.
The seasonal flu is shared far less in warm weather. But Jakarta, Indonesia, a quite warm place, is one of the places that's being spread and growing very fast right now. So I would say early indications are don't trust on that. I think this is contagious enough to overcome the UV light is great at killing virus. It's sunlight, direct sunlight. But this is contagious enough that people might be getting it before the UV light has a chance to help them when they are outside.
So how do you contaminate an Amazon box? Because I know you do, right?
Yes. So we're still receiving Instacart and Amazon for, even though we're, completely zipped up. We have a protocol for receiving our packages. The first part is we have a doorstep that faces outside. I know this is not the case for you guys, but for much of the country, your package is delivered outside. We just leave it outside as long as we can. So at least a day is wonderful, but at least a half a day, we just leave it out there because the natural elements are great at killing things. This does seem to live on cardboard for a day. So if your delivery person were to be the source of contamination, you're looking at a day of there could be virus on it. Now, just a caveat before I go on, your delivery people are your lifeline right now. Please tip them well. But so once the package is inside, first of all, on the doorstep, we spray it down. You have a choice of decontamination material. You can use hydrogen peroxide. You can use alcohol at 70% ethyl alcohol to spray it down. I use white vinegar, and that is a bit of a controversial choice. You will see a lot of scientists argue over how great it is. I like white vinegar because you could drink it down your throat and it would not be toxic at all. And household poisonings are a big cause of accidents, biggest cause of accidents inside the home for children. So I like to keep something that
vinegar. Is that just like you just spray it down, or you really like wet a paper towel and go?
I put it in a spray bottle and just spray it down. So think about hydrogen peroxide or alcohol would be the least controversial choices here. Spray them down, let them dry, carry your package inside, open it, and while you're doing this, think of yourself kind of like a doctor. Walk around with your hands like this so that they seem dirty to you, right? And then open your package, empty all the things, lay them out on the floor, and then, take care of deconstructing your boxes, put them away into the trash, wash your hands at this stage. Then spray everything that's on the floor down well with vinegar, let it dry a bit, 20 minutes, turn it over, spray it again. I'm saying vinegar again. I'm saying alcohol, ethyl alcohol would be wonderful here, 70%. Then after it's all dried, you can pretty much assume it's okay. If it's vegetables, if it's things with folds in it, I've just dumped them into a soap bath for a second and then let them dry just to be extra sure. But that's the decontamination. You just make sure that you treat it like there's germs on it, you clean it, and then you put it away in your home.
Let's say that we're going to see the broad spectrum of quarantine, which is which you seem like 100%. And then there's Florida spring break, which is negative 30%.
Yes.
So we have, as usual in America, no moderation. Given that we're going to continue at this pace because people don't want to listen, what is our future over the next 6 to 18 months? Like, what milestones do we have to hit ourselves? And then when are these therapy drugs? First of all, testing. I feel like there's 3 things medically: testing, treatment, drugs, and the vaccine.
You're right. That's exactly right. So at this point, somewhere, depending on how good or how bad a job we do at responding to this, and how good and how bad a job people do staying home, 30 to 70% of the country will get this virus. Now, keep in mind that frame, because that now becomes our denominator for what I want to talk about next. Of the 30%, let's just say 30%. Know that it could be 70%. But say of the 30%, best case scenario, 80% of them will get something like a bad flu. If they're very young, it might be a mild cold. But they will get sick and they will get better. Now, I don't want to diminish how bad that could be, because I have a friend whose daughter is in Italy, and she's 20 and she's very healthy, and she got this. He said she was quite sick. It was a very bad flu. There were several days where she really couldn't get out of bed, but she did get better.
And some are seeing lung damage, right? Even when they recover.
So let's keep talking about this. Then I've talked about 80% are going to get something that they can recover from. 20%, and in some cases where it goes very well, especially in China where they've done a lot of prevention, 15% end up getting a critical version of this where they need medical intervention, where they need to go to the hospital. First of all, you hope you can get a hospital bed. You hope that we haven't exceeded our medical capacity. You go to the hospital. These people are very sick. These people need the ventilators that we were talking about. These people need serious medical intervention. Of these, 5% become life or death situations. And that's where you get your death rate of 2 to 4%, we hope. But even of that whole 20% that reaches that level, you're looking at a serious likelihood of lifelong problems with your health. Scarring of the lungs, reduced lung capacity, very big issues. And it used to be thought that the definer of who gets into that very scary 20% was just age. And it still is mostly age, but increasingly, just as new as yesterday, CDC study said, was it 1 in 5 to 1 in 7 people in their 20s or 30s are likely to also be in that scary 20%. So your age is not the protector that you thought it was a few weeks ago.
So 30% of America is around 110 million people?
Yeah.
And then 20% of that is
22 million.
22 million will need hospital care.
I think you're taking it into absolute numbers, and this is something where all we can do is follow trend lines. We can't break this down into absolute numbers. We can scare people by telling them up to 1 to 2 million people could die from this. And we can definitely scare our seniors that we're trying to get to stay in place now by saying 80% of all deaths have been people 65 or older. We want to just try to make these people shelter in place, stay at home, don't go anywhere. But those are trend lines, and the trend lines could change in this. This is an active, evolving situation, and the young people congregating like they have been on the beach could be pushing the numbers younger.
Right, and they're making the numbers more, because then they go home and they interact with people who are at high risk, and
they are.
It's a nightmare.
We're counting on that R not being 2.5, but the high level of activity, the terrible timing of spring break, could make the R not higher.
So you mentioned seniors. It is hard to get people over 60 to stay home, actually.
Yes, I know this more than anyone. I have parents, I have in-laws, but I hear my friends especially complaining about their parents. I know it's so normal. This is an age group. We hear a lot, in the president's briefings about how the millennials won't stay put, but all of the people who are, Gen X that have parents, they're trying to beg them to stay put, just stay home. And this is an age where people don't want normal broken. They don't want to be told, to behave. They don't want to be told. My father-in-law, I wanted to not go to the dentist. And he's like, well, I've had it scheduled for a month. Why wouldn't I go? And it makes sense to him to go. My father, I said, why did you go out to get cash yesterday? This is really stupid, as not being the kindest daughter. And he's like, I had to get cash to pay the guy that cleared my snow from my driveway. And I was like, you can use Venmo. I can help you. And he's like, I don't want to learn to use Venmo. And I'm like, this virus is going to require much bigger sacrifices than this. But imagine all of these very normal generational conversations that we would be having with our parents are happening over a deadly virus.
Well, think about it. Like when people are told to get the flu shot every year, that's a big part due to herd immunity, right? But
yes.
People don't know that. And I think we're disconnected from community. Like if we're doing okay and everyone around us looks fine,
we're the bowling alone generation. Social cohesion has never been lower. When you're asking people, especially the younger people, to do this for the sake of your country, they're like, what did my country do for me? Look at my student loans. And I'm like, no, that's not comparable.
I want to go back to something you touched on a little earlier in the chat when you talked about quarantining and locking down and your psychological well-being.
Yeah.
Do you have advice for that? Because we've already been locked down for about 4 days of just working from home. Plus,
sure.
On top of us generally not liking to go outside, now being told we can't go outside, it can take a toll. So what do you have advice or measures of how people can take care of their mental health while stuck inside? Especially, again,
right.
1-bedroom apartments in New York.
I feel for you. I lived in New York for 15 years before this year. And I do know that my friends, especially imagine those that have college-age students who are now moved back home with their parents and everybody's in a small apartment together. I'm hearing from my friends that this is a very hard thing. And I can imagine it's hard. I can just say that the country is going to ask bigger sacrifices from you moving forward. You've got to get used to it. You've got to understand this is a wartime preparation.
So speaking of moving forward, what do we have in store in the next 18 months?
Sure.
And this is only projection. I'm not holding you to it, even though you're going to be right and you should run for president. But
anyway. I'm holding you to it. She's not. I am.
So in the coming 2 to 3 months, we will see the peak. It will be very scary. And I would say Governor Cuomo estimates the peak will come in about 45 days for New York. The peak will be later for places that aren't getting it as fast as early as New York. The time between now and the next 45 days is going to be a very scary time. You've got to just listen to your public health officials. You've got to stay inside. Do not infect yourself. Do not become part of the burden on the medical staff. That means don't get a household injury. Household injuries are really common. People fall. Don't step up on a chair to try to change a light bulb. Be very careful, right? So don't burden the medical staff with anything else. Be very safe during this time. That's the next 2 to 3 months. The whole country will try to reach peak and then settle down. It's not over then. We're still not really safe because people who did shelter in place, if they were to go out, would become part of a second wave. And we're watching China very closely to see if there's going to be a second wave of contagion when they release restrictions. We do see that people are working very fast on therapeutics. The therapeutics, the things that could treat this to keep it from killing you, to keep you from reaching that scary 20%, they're going to be the salve we're waiting for.
And when is that supposedly coming?
October. We hope we beat our own estimations and it's September or August, but really October. Now, the vaccine is far away. The vaccines entered trials.
Sorry, I was just doing the finger count math of 7 months from now before we get.
Yes.
Before we expect therapeutics.
So what does that look like?
Normal.
What does that look like as far as our life? I'm not going to ask about the economy. We'll talk to an economist about that. But meaning we could have a first wave peak. We might go out. We have a second wave. We quarantine again. This is something we have to get used to for the next 6 months.
Yeah, this is normal. This is, certainly.
Our dog is getting attention, so he's trying to eat the sheets.
That's great.
Also, the dog is also suffering in quarantine.
Yes, and in New York City especially, I mean, in San Francisco already, they've said that even though they're asking people to stay inside their homes, we're going to allow you to come out to walk your dog. In New York City, we're seeing people ask this question. So far, the answer is yes, you can still go out and walk your dog, but I would begin making precautionary steps, like can your building make a pet relief area in the basement, just in case things get so scary that you can't go out and walk your dog.
Wow. Okay. So anyway, back to so therapeutics are due in October, and you said something so insightful on the last interview I heard you on, which is that Hollywood has access to this. You didn't say it, he said it, Illuminati research. You don't have to say you said that, but.
That's right. I think it's important to look at markets as an indicator of who has a lot of money behind the data and analytics. And I thought one of the first real indicators, the data that I was seeing was valid, was almost a month ago, the James Bond release that was scheduled for early April was pushed back to November. And why is that? Because movie houses are like the first to get closed. You're already seeing AMC has closed their theaters. Movie houses are the first to get closed, and they'll be one of the last to reopen. China still hasn't reopened their movie theaters. And so you can see that they are estimating we can open theaters in November, and that's when James Bond is now scheduled to open.
Do you think the lockdown will continue until November, that will still be shelter in place, work from home, quarantine all those months?
I don't know. We don't have any evidence for what is normal in this. Our best estimation of what works and doesn't work is from watching Wuhan. Wuhan bought us 10 weeks of preparation by starting to get us the data, and we squandered much of that by not preparing. But at least we can watch Wuhan now and see if, as they begin to restrict regulations, as they begin to say, you can come out and go to the grocery stores, but no more than this many in the grocery store. We can wait and see how safe that is. And we should be watching them very carefully, because this is our future. You have several futures in front of you. You have a far future that is 10 weeks in front of you, Wuhan. You have a near future that is 10 days in front of you, Italy. Let's watch what's going on in these areas.
So therapy drugs are like, for example, Tamiflu for the flu, or an antibiotic for pneumonia, or an antiviral. I don't know which one you get.
Yes, yes.
So it de-escalates once you have it.
There are two approaches that I've seen in the literature for this in therapies, and one is exactly what you're saying of Tamiflu shortens the duration of the virus, not for this virus, but of the flu virus. The other that's very interesting is some researchers are taking an HIV approach, which is to reduce the viral load to the point of non-communication of the virus between people. I'm betting on both racehorses. I hope that we have 5 racehorses and different approaches to this, and that early beyond my estimations, maybe by July, we'll get so good at treating this that we don't have to worry about it killing our loved ones and ourselves.
Oh, you're saying July. First you said September, October.
No, I'm hoping that my estimations are wrong and that I'm beat, and that it's in July that something amazing happens. But that's just my fantasy.
Can you please tell me that behind the president, there's actually people doing stuff like you are?
I would say Dr. Anthony Fauci is a god. He's wonderful. And we hope that, he was very strong in the HIV response for the country when things were little understood. And I read today that at that point, he was running 7 miles a day, even though he was doing these 19-hour work days. And someone asked him today, are you still running 7 miles a day? And he said, no, I'm an old man now. I just do 3.5.
Ah.
So may he stay healthy and strong and guide the administration, because we still have a very good scientist that's behind that line.
Good. And have we ever seen, just to switch gears, a virus like this that doesn't really affect children?
It's super weird.
It's eerie.
I think it's hopeful, because we can try to figure out, what in the genes we could mimic, in genetic therapies. It's one of the other horses I would say is CRISPR genetic therapy. I would say they should have added that 3 horses in the therapeutics. I'm glad it's not hurting children. It's great, but it does make the children the vectors.
Oh, that is so creepy. It's like a horror movie.
I wonder if it's the same gene that lets them see ghosts.
Yeah, probably. So we talked about the testing, the therapies. Let's talk about the vaccine. That's the big one. How far out?
Vaccine's far away. So we just started human trials this month. That will take 3 months to see if it's safe to give a lot of humans. We have so many good starts to the human trials. I hope that of the 6 or 7 that I think are going to start this month, 2 already have, that maybe 2 or 3 different vaccine approaches will make it on and pass human trials and be a producible vaccine. That will take 6 months at least to ramp into production. Most vaccines traditionally are made using eggs. So I hope there's someone smart out there saying, let's start hoarding eggs for the vaccine production, because in H1N1, a shortage of eggs was one of the limiting factors. So they have to produce all the vaccine. They have to get it ready for distribution. That will take at least 6 months. Then they have to start distributing it to the important people first. And that's especially the doctors and nurses. Right now in Italy, 8% of the critical care patients are medical providers. And certainly in Ebola, you saw that healthcare providers were 20 to 30 times more likely than the regular public to get Ebola. So get the vaccine to these people first, and then begin distributing it to the regular population. You're looking at, if all of that goes perfectly, the vaccine will be available in 12 months, but most experts are saying, don't plan on perfect, plan on realistic, based on what we've seen with vaccines hitting hurdles before. It could be 16 to 18 months. The vaccine is wonderful because at that moment we can exhale. At that moment we can say, like, okay, I have the vaccine for this. Until then, the virus will live with us, and we just have to get better at living with it.
Is Dr. Fauci involved in the vaccine?
he's aware of the vaccine trials. I would say that the vaccine trials are happening around the world. One of them in particular is in the US that started human trials this week in Washington State. But many countries are pushing very hard. Australia, Israel, UK are pushing very hard. So he's not the be all and end all there for vaccines.
Are they going to share info, or are they going to hide it from each other like HIV to make money?
No, I would say there's an overwhelming, what would you say, dedication that this would be open access vaccine. There was some rumors that the US tried to get a proprietary vaccine, but it was squashed from Germany straight away.
Good.
And that the international community said so fast, no, every vaccine shall not be proprietary.
Great.
Yeah. So I want to like end on a positive note, and I don't want to take up too much of your time. We could talk to you for hours. You're fascinating, brilliant, and
Sure.
despite the fact that you're sealed up and I just realized I'm doing everything wrong, you give me hope.
Ending on a positive note's a hard one with this one. I would say this is the scariest thing we've ever faced in any of our lifetimes. Like, you know, in all the movies, this is what I think of, like the opening scene of Arrival, you know.
Not of Arrival. Because
one of my favorite movies.
Work together. We need to work.
Yes, but the opening scene, this is like that. Like everything is going bad, and we're in the opening scene of every movie right now, and it's time for the whole world to start working together and for giant federal responses. This is Herculean. As Bernie Sanders rightly said, more casualties will come from this than World War II. We have to be ready for bad times, for hard times. We have to put down our own needs to leave the house, to get, you know, sushi. Just sit at home. Just sit at home and eat ramen for 2 to 3 months. If the whole country could just sit at home and not go anywhere for even 1 month, we'd have this done. But we just need people to sit at home.
Okay, sorry, we lied because you reminded me of another question. He's going to have something. So
please.
I know you're great on Facebook. I'm lucky I'm one of your friends because everyone has a 5,000 person limit. So I got in just in time before this airs, and everyone's going to want to be your friend. But what is the best food to stock up for, and for how long should we stock up? Because I know you mentioned some really good.
Excellent.
So I
have a stock up shopping list that I can give you to post if you want.
Yes,
I recommend.
Oh, that'd be tremendous.
I recommend shelf stable things of things you would really eat. So don't be like altruistic, like this is the time I'm going to get healthy. Don't be like actually things that you eat, but shelf stable versions. US and
Ice
people,
cream is a good idea.
and as long as your freezer is big enough, go for that. But in the US, people really like pastas. I say like spaghetti is one of the easiest things to keep that shelf stable. I like sardines a lot, and sardines are amazing shelf stable proteins. Canned chicken, if you like meat, you have to think about what you could actually keep for 2 months, because 2 months is your minimum that is expected right now that you have in your home to eat. Minimum, yeah. You're looking at 8-week shelter in place at this time to get through the peak. Like consider 45 days from now in New York is the projected peak, right?
Is that with delivery or no delivery?
You have to decide your own safety boundary. I personally don't want to. I know that economically it's great to support the restaurants, and I love restaurants and I love New York delivery. Personally, it's beyond my safety boundary to eat food that someone else has prepared and brought to my home, because I can't like do my 2-day decontamination that I explained to you.
No, I just mean like Instacart, Amazon.
Oh, Instacart, Amazon, yes. But a lot of people are saying they would recommend still allowing restaurant delivery during this stage, as long as you changed all the containers and washed your hands after it got there. So you have to decide your own personal boundaries of safety. I have a lung condition, right? Like I have lung inflammation and asthma. So I would be in the high risk if I got this. So I have the highest levels of safety, and I do not accept cooked food as a safety option. Some people do. You know, and you have to consider New York apartments are so small. How could you keep 2 months? A friend of mine said she's got what she thinks is 1 month, and her apartment's just stacked with food, and she doesn't know where else she would put it. So it's different for everywhere you live. Out in the West, I have what's called a deep freeze, an extra freezer in the garage that keeps all the extra, frozen tofu and frozen meat that I might want.
Yeah, and you
Lots
mentioned
of
beans.
tortillas.
Beans.
I'm so bean based. I think beans are the perfect COVID food. You can alter, you can switch between pinto and black and lentil. I am very much into a good dal for breakfast and rice. So rice and beans are forever the best food. Beans will stay good for 4 months. We've put in a COVID garden so that after 2 months, we'll start producing our own food. We've got potatoes and beans and peas and salad growing out there.
Wow. And before, I know you have questions, but what are we doing right in our public health system? Because I want to talk about something positive. Am I just naive, or?
It's sweet. It's endearing. It's why I like you.
I like that people are thinking about the measures of the food insecure, because think about, I've just said, oh, you should have 2 months of food. And if you don't have the liquid capital in your budget to buy 2 extra months of food up front, this is a measure of elasticity. How far can you stretch before you break?
Yeah.
And there, something like 40% of Americans are living paycheck to paycheck, and they don't have the elasticity to spend 2 months food budget at once like I did. So certainly the backup food systems, my biggest donation that I made this month was to a senior food delivery program similar to Meals on Wheels here. I think the best thing we're doing is to try to take care of those people whose elasticity is going to be exceeded by this emergency.
Wow. Thank you. Any other questions before we stop? And
did we hit everything on the list?
Yeah, I think we did.
I just want to circle back one last time for tips to sort of keep our heads straight while we're in quarantine lockdown. This is it's such a big change for everyone, and you said more drastic changes are coming.
Yeah.
So how do we keep our heads right?
I feel the depression setting in. Today was a hard day, and it's only day 4. So
I mean, I've been joking that they should.
We wouldn't leave anyways.
Yes. I've been joking that they should start putting antidepressants in the water supply, but it's a joke. But
no, that's a great idea.
That's a great idea, Annie.
Annie 2020. Annie 2020. Annie 2020.
No wonder you run water for all these countries. They're all happy. That's why they keep charging.
Happy water. I think there are ways to gain frame your perspective and to get in charge of it. Being aware, having bought so much of my food that I would have consumed anyway all at once in the next few months, made me aware of my consumption. And I feel terrible about my consumption. I started composting for our COVID garden, and I am so glad that I compost now. We will be changed by this. So we should try as much as we can to gain frame the impacts, not be trauma, to be changed for the better. I've never seen from the view from here, I can see the beautiful Juarez Mountains, the Sierra Madres. I've never seen them so clearly as I've seen them this week, because so many fewer people are commuting and the air is clearer. So I can focus on that. I can try to focus my mind on this is actually a positive impact for the world. And when
in Venice, we can now see that there were fish in there the whole time.
Yes,
yeah, we're
exactly.
Pop up now, air, water. Maybe this is our sign, and I hate to say this because there's going to be casualties, so I'm not making light of that, but maybe this is our sign for us who are living that we have to respect the earth.
I think that there's a good way to frame that in your head. You can gamify it in your head. You can begin. I have a friend who created a spreadsheet of how many calories his family normally goes through so that he could gamify the food, consumption pattern. What I see that some people really, really don't like structure, and structure themselves is a bit of a traumatic force. And this is a time that will require a lot of structure. So I think that's the personality type that will have the hardest time with this, is you must stay inside. You must not go out to a restaurant. You must act this way. That's going to be hard. And so for those people, I would try to make this a time of personal growth, of really dealing with this in a positive way, and try to keep it from being a trauma. Because if this is a trauma, it is a two-wave emergency. There's something in Zen Buddhism called the second arrow. The first arrow, hits you. The second arrow you hit yourself with, because you let it become a trauma. And you have an option here to try to like dive into some Duolingo, dive into some online classes, try to make 8 to 12 weeks of this into personal growth as much as you can so that you keep this from being a traumatic time in your life.
Thank you, Annie. Anything else? That was beautiful, seriously.
That was the positive note that we wanted to end on.
That was a
Look at
positive
that.
note. We're all going to die, but on a positive note.
Yeah.
Okay. Very good. I'm sorry it's such a hard topic to talk through. It's very hard to find, good news when you're saying that so many people are about to suffer, and there's just this moment that you think this is going to hurt. Like it's like when they replay the Olympic athlete right before the horrible injury happens, and you see it like, oh, this is going to hurt. And in the span of time, when you look at what's going to happen to humanity in this next 12 to 18 months, this is going to hurt.
Real quick, elevator pitch for the non-believers who say this is just a cold, this is just the flu. Like elevator pitch, 10 seconds of what we can say, because people are saying that a lot.
Oof, it's just going to be a matter of 10 days before their minds are changed.
Okay, so I don't have to say anything, just let.
You don't have to worry about them. There's overwhelming evidence. I think it's telling that even the news institutions in our country that were very slow to grab onto the seriousness of this and saying like, I still hear a few politicians saying like this is a hoax, but almost everyone now is like, no, this is real. We absolutely need you to stay home. And the stay home message has to be reinforced. You can't say it strong enough. Your civic duty, the thing you can do for your country right now, is to stay at home. Don't go to the bank. Don't go to the doctor. Unless you're very, very sick. But if you had a regular appointment, if you had a long-standing, I need to get this done, your normal has changed. And this is very hard, especially for certain generations.
And don't change a light bulb in your home and get a home injury, because that's on you. You're going to have to set your own leg.
The home injuries are really, really going to be a big problem now. And
especially spouses killing each other because they're quarantined.
Yes.
Annie, thank you so much.
If I die, it's not from COVID.
No.
I was opening a can of tuna a month ago, and the can opener slipped, and he needed 5 stitches in his hand. And imagine if he did that today, I wouldn't feel comfortable sending him in.
Just curious, when did you seal up?
We sealed up, soft sealed up 2 weeks ago, really sealed up this past week when we finally got our teenage kids in.
Okay. And you and your husband haven't touched, right? Because he brought your kid home.
That's right. We're keeping our 6 feet away, no shared surfaces, and looking forward to that being over.
Yeah, no kidding.
One last question. Do you have room for 2 more and a dog?
I want to before we get there.
I want to. I feel like we should make, and I think about this a lot. I feel like if people would all self-isolate for 14 days, we could make COVID-safe dinner parties. Like if you'd have to trust that the other people really did.
Right.
But then you'd be okay to see each other.
I guess, all right, sorry, one last question before. I know we've had like 8 last questions, but one of the terms going around, one of the requests going around is to check on the elderly, check on those who live alone, who might need an extra hand for whatever reason, getting those groceries, extra paper towels, whatever.
Right.
Is the precaution the standard decontamination process you talked about before? Is there something else we should do? Because there's the balance of saving ourselves and the civic good of staying in, but also helping those.
In any emergency, like a hurricane or certainly this outbreak, 90% of the assistance that is going to be provided is from human to human, just neighbor to neighbor, friend to friend, not from official organizations. So be part of that 90%, right? And that means do check on the elderly, the vulnerable, the people who live alone. They maybe have health conditions you want to be careful to check on, but check on them by phone, check on them by text message. Don't come and see them. If you do see them and they open their doors, take a few steps back and just say, I just wanted to talk to you. And talking to you might be a great benefit, but stay 6 feet apart.
Yeah.
And then if you do need to get them things, if you need to bring them a delivery, take the time to decontaminate it for them and deliver it to them fresh and clean.
Great advice, Annie. Thank you. I'll see you on Facebook.
Thank you. Thank you so much.
Best.
Bye-bye.
Bye.
Thank you, Annie.